Canada's first social medicine housing development has officially launched in Toronto. The city, along with one of the largest hospital networks in the country, as well as other social agencies, have come together to provide tenants not only with affordable housing, but access to health care. Dunn House, a new 4-story modular housing building in Parkdale, includes 51 apartments for people experiencing homelessness who are also patients with high volumes of emergency visits.
It really is about a secure roof over the head, but it's also a chance to turn your life around.
The initiative is a partnership between the city, the University Health Network, United Way Greater Toronto, and Fred Victor, the project's housing provider. The space will provide housing stabilization supports, social and community integration services, daily meals, mental health support, harm reduction services, and healthcare support.
Housing by itself doesn't work, and the medical system by itself doesn't work. For a lot of people, you've got to integrate the two.
The studio apartments are fully furnished with a kitchenette, living area, bedroom, and bathroom. Tenants will pay no more than 30% of their income or their shelter allowance on rent.
Tenants will sign a lease like anyone else in the city who's renting. They will sign a lease, and that's when I say it's secure. It's security of tenancy. So with a lease, obviously, comes responsibilities. So people do pay rent. People do have responsibilities as anyone else would in a housing or an apartment building. But here, we have expertise and support services on site to help that transition from being homeless.
UHN says the top 100 patients without fixed addresses accounted for over 4,300 emergency department visits in 1 year, and that people who are chronically unhoused live half as long as those who are housed.
We know housing and the housing crisis is very real for hundreds of thousands of people in the country. And this was a real effort to try to bring different partners together that have not been conventional, right? The hospital, with community, with the City of Toronto and the United Way, to try to ensure that we're building a solution for people as opposed to keeping them in this doom loop that they are facing and trapped in.
The hospital network says they hope they can act as a playbook for other jurisdictions and governments to follow their lead. Tenants are expected to move in the next few weeks. In Parkdale, Catalina Gillies, City News.